Society webinar about risk of pharmacists being affected by coronavirus in workplace. This is the ninth webinar for Oman Pharmaceutical Society. Before to introduce our speaker today, I would I would like to make an announcement that the question will be answered at the end of webinar. If you have any question, just write it in Q&A icon in screen down. To our colleague, pharmacist Jokha Alhinai, she is an acting in charge in pharmacy in C Polyclinic. She is in staff development of event in C Polyclinic. She has bachelor degree of pharmacist from Oman Medical College. She is the focal point of medication safety officer in Wilayat of C. You are welcome, pharmacist Jokha.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, everybody. Thank you for attending my presentation. Thank you, Bushra, for introducing myself. To give me a chance to participate in this educational program. And as we know all that Oman Pharmaceutical Society is lead us to gain more knowledge by different ways, same like workshops, seminar, and now they are not stopped. They keep by using lecture webinar. Actually, my topic should be present before this time, but as they say, come late is better than not to come. So also I hope you will increase the awareness in your workplace. I will present now my presentation. The topic is about risk of pharmacists being infected with coronavirus at workplace. My outline is pharmacists work at frontline and how can be infected, the tip to follow to decrease the risk infection of COVID-19, the crisis that we faced during pandemic of COVID-19. Pharmacy staff are frontline respond to the COVID-19 pandemic. So their top priority is to stay protected and health while caring for patients.
Pharmacist Jokha. Although protection measure has been followed by the pharmacists, there are some pharmacists infected by coronavirus. How this happened?
This is what I will talk about it in the next slide, Bushra. So how can be pharmacy infected by coronavirus? First, we are all know that the virus are transferred by airflow. So when the pharmacy windows is open, the chance to the chance is to get the virus from the airflow. Also, when we have secure door, for example, when I'm entering to the pharmacy, I will use to put the bin number in the secure door. So the second staff are come and also use the same number. So for that, we can infected by this touching, by hand touching, and we didn't know which staff are infected or not have this virus. Also, staff who are entering the pharmacy. There's many staff entering pharmacy. For example, in patient pharmacy, there is a nurse who are come to take the unit dose for their work. Also, the cleaner who are come to clean the pharmacy and then go to clean the other clinic. And also the driver who are come to take the medication to different health institutes from medical store or from pharmacy. The worker who are bring the medication to supply our store or supplying for pharmacy. Also by handling paper. As we know now, all we have a system that we not need to the prescription paper. But there is some prescription that we are need, for example, like control medication, same as green prescription, narcotic prescription. And for the private hospital, private pharmacy, they need for antibiotic prescription.
Pharmacist Jokha. Some prescription paper, as you said, must be handled by pharmacists, for example, green prescription. Yes, so how can decrease this risk?
As you know, Bushra, that the virus are transferred by the paper handling. So to decrease this prescription, not want the patient to go and come the pharmacy many times or go to the clinic. So first, before we are do, there's for green prescription, for example, there is written medication only for 1 month. But now we are keep to be writing in same prescription for 3 months, and we are to keep this balanced prescription with us. So also the number of pharmacy staff inside pharmacy. If the pharmacy is too small, so there's no distance between each pharmacy, each pharmacist, so that is the lead to infected. Also medicine return. When the patient are coming with a lot of medication, want to be returned to the pharmacy, you should not take that, and you should ask them to keep it if you have, for example, like a bin, recycle bin, you keep it near to the door outside pharmacy, and you can divide it in 4 or 3 sections for tablets, syrup, myceliums, and injection, and ask the patient to keep it there. If there is no sink inside pharmacy, so the pharmacist can wash hand each 20 seconds frequently, but they can use hand rub. Also, if there is no gap between patient and pharmacist, this is the big chance that they can be infected by virus.
Jokha, we have many risks that increase the infected pharmacist. What do you think the biggest risk that increase pharmacists by infected by coronavirus?
Regarding my experience, in my opinion, Bushra, there is some stuff are infected by virus, and when we search about it, it's actually come by worker who are bring the medication to the medical store to the pharmacy, and also maybe by from the driver or from the handling paper prescription, and also by the cleaner sometimes. So now I will complete this the tips for workflow improvement. First tip is about prescription order and refill. When the patient came to the pharmacy and want to give you a health number, don't take the health number, but ask to tell you their number and write it in your paper. If he don't know that, you can take their civil number if have ID card, and you can go to patient search and bring their health number and then prepare for him the medication. And do not handle or accept any patient bottle or refill. If he asks you to put this loose medication, don't take it, but keep it in a new bottle, and don't handle the patient medication. You can keep in their plastic bag, you keep it in the container, or if you have a shelf near to the window, you keep the medication for him to take. Encourage patient to call and refill to avoid extended waiting at the pharmacy. Now all health institutes have WhatsApp number, so you should advertise about your number and let the patient to send the message there by health number, name, and civil number. And then after you finish, resend message to them to come and take their medication. Not keep the patient talk with you without wearing the face mask, and you should also wear the face mask. Not keep patient waiting in queue. So how this will be happen if you are only 2 or 3? You can manage that, and you can successful about this. You can work fast, but be careful with less of medication error. The second tip is transaction, and this is actually for the community pharmacy. All pharmacy staff handling money, cash, or credit card should wear gloves, and you should use no, don't take the debit card. You should take the credit card to avoid pen input. No signature is required also. And you should clean the credit card machine keypads between each customer. And if you have delivery personnel who are taking medication from the pharmacy to the customer or to the any health institute, you should ask him to wear gloves and have sanitizer and not enter the recipient house. When receive medicine to your store or pharmacy, you should keep distance between you and the worker, and you should wear face mask, a shield, and gloves, or at least you should wear face mask. and you should wash your hand after that. The third tip is staff consideration. So all we should wash our hand frequently for 20 seconds per each washing, or we can use hand sanitizer containing at least 70% of alcohol. We should all have face masks during all time in our duty. I encourage all the medical health to take influenza and pneumococcal vaccine. It is strongly recommended during the COVID-19 pandemic due to increased risk of serious secondary infection. And I'm not saying it is a treatment, but it's at least a prophylaxis for you. You should maintain social distance when working with the pharmacy. If you are 3 in one side, you can work with 2 and make there's a distance between you and your colleague. Or if it's small pharmacy, you can work by 2, each one in one side. At least you should clean your surface within the pharmacy regularly using cleaner known to kill the virus, same as alcohol spray, or use alcohol to clean the mouse, keyboard, and the table you are working with it. So what's the consideration of pharmacy? Now I want to know each institute or pharmacy, what they do for this one. For example, what we are doing in our polyclinic, we put physical barrier between patient and staff. For example, like tape can be placed on the floor, mark that the safe stand between patient and the window of the pharmacy. And for example, for private pharmacy, they can use shield at cash register. It can be by plastic shield or it can be glass. Also, we consider removing all patient seating to limit surface that may not be able to be cleaned and disinfected. So that's one, or you can keep one seat in middle. There is no seat there. You can mark as X. Limit the number of individuals permitted inside at any one time to fewer than 10 people, and this also includes the pharmacy staff. Should be done to facilitate social distancing.
Before moving to next point, what is the challenges that face pharmacy staff in this pandemic, and how can we solve it?
Yes, Bushra, this is what I called crisis. This crisis that we are faced. There's many crises in my institute and other institutes, but I will talk about some of them. Shortage of staff versus number of patients. When we are decided to divide us into groups and we are working with 3 staff, so we are here faced a big challenge that we have 3 staff versus to exposure to more than 200 patients. So we should work fastly, and as I said, we should also minimize the medication error. And for that, we are done, and we are successful for this for 2 months. And then we are canceled it because the number of patients are increased more and more, and some of our staff are infected by the viruses. Shortage of medication. Some company can't supply or import the medication to our region store, so that we are faced. There is some shortage of medication, but we are thanks that DGMS are work fastly, and they bring within 2 weeks or less than 1 month. That's new company of some medication from other company. Also, we face that lockdown of Muscat versus patient outside Muscat. There is some of our patients are outside and they can't come to our pharmacy to take their medication. They send for us a message, they want medication, but we are thank also here the DGHS that they prepare for us this way. They call the other polyclinic, then they prepare collect their health number. We ask patient to go to the near polyclinic, for example, Barca Polyclinic. They collect their health number of our patient, then they send for us. We prepare, then we send it with the driver to their clinic. And also for Al Masarra Hospital, they do same. They bring the medication of patient to our polyclinic, and we give it to the patient. Also, sterilization of pharmacy. Pharmacy is not clean, same as clinic clean at the morning and night. It's only once because we should close the pharmacy. And if we have any staff are infected, we can't clean all the pharmacy. Or we can't clean the shelf. We can't clean the medication that he touched. We can't clean the file. But what we do, at least we wash our hand. We clean our surface. What we are use only. Here I will talk about the other country experience to minimize risk. If you go to the bank and you for renew your card, there is a machine. You call the staff there and you ask him about your issue, and he solved that issue by ask you to enter your civil number. Then you put your ID card, take photo for your card. Then he solve your patient. Then he give you the new card. What we will do by this machine? The patient are come to this machine, enter the health number, call the pharmacy live. So that's he tell him what he should do. If he have medication, they will ask him to wait and they will send message for us. We prepare, then resend message for the patient, they come to take it. If he have any question or want any consultation about medication, they can be answered directly. For community pharmacies, some country they do that drive-through. The customer will go through this way. They ask the pharmacist about their prescription. They take it, and they have mobile payment process. Also, they have online application. They do it. They choose what the medication want if she know, or and send it by delivery, or they can go and take it. Also, some country have warning system device. This the patient come to the pharmacy, give them the health number, then they give them the device, go to his car. Then when this device are alarmed, then the patient return back to the pharmacy and collect their medication, and not keep the patient to wait too much time near to the pharmacy. Thank you. This all. Thanks for your attendance, Bushra. No.
Now the time is for question. Thank you very much, Pharmacist Jokha, for this informative presentation. I hope all pharmacists be safe, follow the instruction, and be more and more aware and committed. If you have any situation in this pandemic, share us your experience and what you do to solve and deal with this point. Follow Oman Pharmaceutical Society in social media. Just write Oman Pharmaceutical Society or OMPHS 2007 and you will find it. I want to tell all pharmacists that Oman Pharmaceutical Society is for everyone. If you have any suggestion, any idea, just contact us and we'll come anytime. The online lecture will be continue for next week, inshallah. Also, I want, yes, Jokha?
Yes, there is one question. Is excessive use of sterilizer will solve the problem or create another problem? If you know about, if you mean about sterilize is hand rub, I don't think it will be cause another problem. It can be solve the problem.
Thank you all for participating to attend this webinar. You want to tell anything, Pharmacist Jokha?
Yes, I would like to thank all who's participate us in this lecture, and also I want to ask all the team of Oman Pharmaceutical Society for their work, and I am appreciated about their work. I would like to thank pharmacist Hamad al-Na'mani, pharmacist Saud al-Ghafri, and Mahmoud Shandoudi, and especially thanks for you, Bushra, for your support, and also for all my colleagues' support. Thank you for all. And I hope all pharmacists keep learning from this Oman Pharmaceutical Society. Thank you for all.
Thank you, and don't miss the evaluation. Thank you all.